Good evening. My name is Dr. Amaris Lavender, and I am the Chief Program Officer of the YWCA of Asheville. I want to begin by thanking Buncombe County for partnering with the YWCA for this important work, and I'm going to give a brief overview of how we all got here today. So this past summer, Buncombe County acknowledged that racism was indeed a public health crisis, and the YWCA, along with several other partner organizations in town, supported this proclamation. United, we wrote to our county commissioners to put it on the agenda and move it to a vote. Our county became an early adopter of naming racism as a public health crisis. We see today's Let's Talk COVID, the vaccine, as a key step in forwarding the actions of the summer with community conversations. At the YWCA of Asheville, our mission is to eliminate racism and empower women. We understand the need to share in this partnership with Buncombe County to intentionally hold space for this pertinent conversation, respecting the lived and the historical experiences of communities of color as it relates to them seeking medical care in the United States. Now, of course, we won't be able to touch on everything today in our hour-long conversation, but we're looking forward to getting the conversation started. The Buncombe County team will be publishing the Q&A of today's event on their website, as will the YWCA of Asheville. The buncombecounty.org is a website where you can find their information, and our website is ywcaofasheville.org. All of this will be available after tonight's event. With all that said, tonight I'm joined by a wonderful moderator and a great group of panelists, and I'm sure we are going to have a riveting and exciting conversation. First, I'd like to welcome Dr. West.
Hello. Hi, Dr. Lavender and guest.
Next, I'd like the panelists to introduce themselves.
Hi, my name is Cristina Cardenas. I work for Western Carolina Medical Society. I'm a health access coordinator for Project Access, and I'm also a community health worker. One of my other tasks is I'm a Spanish interpreter for the WIN Interpreter Network.
Hi, my name is Rosario Villarreal. I am Community Health Coordinator for YMCA of Western North Carolina and Community Health Worker.
And good evening. My name is Dionne Greenlee-Jones. I am a Community Engagement Manager for Unitas and NC Care 360. We work together through community engagement to address health equities, and I'm excited to be here this evening.
Dr. West, would you like to introduce yourself as well?
Sure. So I am Sharon West, and again, welcome to everyone. And I am a clinical ethicist. I am also a registered nurse by profession, and we'll talk a little bit more about that later.
Speaking of that, so Dr. Sharon West, you are both a clinical ethicist and historian. Can you start off by first describing what a clinical ethicist is? And as a historian, give us some past and present medical injustices leveraged against people of color and women in the United States that relate to the conversation today.
Okay, sure. And again, thank you, Dr. Lavender. It's an honor to be able to co-moderate this panel with you, and I'm excited to hear from the panelists. So what is a clinical ethicist? A clinical ethicist essentially is a person that's trained to guide individuals through very difficult discussions. It's clinical, so the arena is mostly medical. We work with patients, we work with families, and we also work with staff that may have a difficult time navigating through. Of course, we use the principles of bioethics, and one of those that I tend to focus on a lot is justice. And so we try to make sure that we allow the patient, if the patient is able to speak for themselves. If not, then we want to make sure that the families remember, and also the staff remember, that the decisions that are that garnered through these discussions are decisions that are in the best interest of the patient. And I think clinical ethicist is prime in a situation like what we're talking about now. Tonight is the COVID-19. There are people who are having true dilemmas about, do I get the vaccine? Do I not get the vaccine? what about the information? Is it all I need to make a decision? We want them to come to a decision based on their values and their beliefs. So enough about me and what a clinical ethicist is. So I like your second question, and that is about the medical injustices. One thing that I learned in my doctoral program, and I love this quote and I use it a lot, and that is, what we learn from history is that we don't learn from history. The roots of distrust are not fabricated. So what you're going to hear tonight, audience, and the stories that you hear, the narratives, I should say, they're not fabricated. This is real talk. The unethical, the historical narratives are very much present, and it's very much a part of the collective conscious of people who are my age and older, and what society has pretty much said to people who are Black and Indigenous people of color are, you're not valued very much. And this is the makings of a long period of time of mistrust. These scenarios are present day as much as it is historical. So let me just talk just about a few, because there's a list. There's so many different narratives that have occurred in our history. When we think about Dr. Marion Sims, who was a gynecologist, and Dr. Sims is known as the father of modern gynecology. And he would do procedures and surgeries on enslaved Black women without anesthesia, because he felt that Black people did not have the same level of pain as white people. So why the anesthesia? He would give them a dose of morphine at night to help them sleep, because guess what? The procedure started again soon thereafter. And then you may have heard about Henrietta Lacks with the HeLa cells. This lady came in and she went to the hospital because she had a growth on her cervix, and they wanted to do a biopsy, African-American lady, and they wanted to do a biopsy on her, and they discovered something that was just miraculous. They're like, these cells multiply many times over. So then they commercialized her cells, and she knew nothing about what was going on behind the scenes. And guess what? Some of that medicines that are made from those cells are still being used today. They receive no benefit, no financial benefit, or any information, and again, no consent about it at all. And then we hear in the past about the sterilizations, you know, what they call the Mississippi appendectomies, when two sisters went in because their parents were encouraged by their white physician to get contraceptive injection. And they received this contraceptive injection. They were ages 10 and 12. And when they received this injection, the physician then decided that they should also sterilize the girls as well. The parents knew nothing of this. And when we look at present day, and like I said, there's many more. And I want to say this at this point in time, there is a book that's written by Dr. Harriet Washington called Medical Apartheid. If you want to read more about this, please do. And there's plenty of stuff on YouTube about these scenarios as well. But if we look at present day, we look at a pharmaceutical company who wanted to push forth a medication that would target congestive heart failure, and the FDA did not approve it. The FDA did not give any support for it whatsoever. But then they went back and they said, we need to repackage this. But what we can do is we can target the Black community, because there's a high percentage of African Americans with congestive heart failure. And this is what they did. And so they targeted the Black community, but knowing that the medication was originally developed for the general population. Studies show that it doesn't work any differently for Blacks than it does whites, but the profit became the purpose over the people. So here again, medical injustices without any type of validation for it. And then you probably heard about this case that was fairly recently released on Facebook, Dr. Susan Moore, a Black physician in Indiana, where she was able to videotape her own story, her testimonial about what she was experiencing in the hospital as a physician who had been diagnosed with COVID-19, a patient herself. and how she felt she was mistreated. No, we don't know all of the ins and outs. We don't know what really happened or, any other information other than what she had the energy enough to share with oxygen in her nose, and she did not want to be discharged. She was discharged and died later. So it's very interesting how we do have these historical narratives, and this is real. As I said, the roots of distrust are not fabricated, they're real. Thank you.
Dr. West, thank you for that enlightening backstory and historicization of our present realities. Now I'm going to ask the panelists, how do you think some of these historical and contemporary inequities, maybe that Dr. West shared or some that you're familiar with yourself, are impacting communities of color's perception about the COVID-19 vaccine? Cristina, I'll start with you.
First of all, I'd like to tell my lovely Latinx community that there's no reason to fear. Ask questions, inform yourself so that you can make decisions about the vaccine based on facts and scientific data. Lack of information leads to misguided fears, rumors, and spread of misinformation, we all know that. So it's not a matter of getting the information out there. What I've seen is that it's a matter of being thoughtful about how and who the information, who delivers this information. Just throwing information at a community that is already shrouded in fears and apprehension and mistrust, it doesn't stick. It doesn't stick. So I know that just knocking on doors, visiting communities, visiting churches is probably a better way to access, to give this information directly to the communities from a source where they're going to be comfortable and increase the chances of them actually believing it,
I was muted. Rosario, how do you think these inequities are impacting communities of color's perception of the COVID-19 vaccine?
It's just like all the histories that we just listen about the Afro-American community. We have so many histories too in the Latino community that are happening right now. They are happening in the border, they are happening in our communities when they are looking for care and when they are turning down because they don't have a social security number or they don't have insurance. And all that is going to create a lot of mistrust in the system. And if we put with that mistrust of the lack of information that is around, it's going to be very hard to get the Latino community to trust the vaccine.
What are some common reservations or fears about the vaccine? What are you hearing in your work with the community? And how do you think the medical community can help calm some of these fears in communities of color? Dionne, maybe we'll start with you.
Well, again, we're listening to multiple groups of people talking about what they fear. Again, the vaccine is often, I'm hearing over and over again, the vaccine is often too hard to get, even when it's available. The fact that we're encountering issues with people getting vaccinated, how they're communicated with in order to sign up. And then if they get appointments, having to wait in long lines in cars or at practitioners offering the vaccinations, people are just concerned that in the African-American community in particular, that they're being overlooked, that even if the vaccines are made available, when are they going to be able to, it's so difficult to get it. And then again, fears, historical fears, based upon some of the information that Dr. West provided. North Carolina often had experiments with sterilization with women, and people, it's not that far, it's not that long ago. So people remember Tuskegee. They remember instances where African Americans in particular were those that were disenfranchised even further by some of these experiments. So they're scared. People are legitimately unwilling to take chances with their health when they're not quite sure who they can trust.
May I chime in? So in the Latinx community, I've heard that the vaccine will hurt me, that it's expensive, that I don't qualify to get the vaccine, that it's dangerous, and therefore I should wait and see what happens to this person that already got their vaccine. I interpret at the COVID testing sites. So I've had the opportunity to speak to a lot of them and ask them, you know, first of all, thank them for coming out and getting tested, and also encouraging them to tell their family members and their friends and neighbors that if they have, if they think they need to get tested, they definitely should. So I think that fear stems from, or that, you know, apprehension stems from fear that if I get sick and I need medical attention, I won't be able to get it. Or if I, you know, what if I go to the hospital and I'm going to end up with a bill, you know, owing thousands of dollars? And what if they ask me for an ID or my documents and I don't have them? So all of that, all of those fears are more important than the thought of, oh, I have to take care of myself. So we have to, you know, reassure them and educate them. But I think like 1 or 2 posts on a website, on Facebook, or a 30-second slot in the news is not going to be enough for the Latinx community. I think these fears have been a part of their daily life for so long, for decades and decades, that it's going to take years to help them overcome them. And I think, like I had said briefly before, like a boots on the ground approach is vital. Yeah, just handing them a brochure is not, that's not going to be enough.
And I just want to add to what Cristina said, that is just to the point, that we have a lot of anti-vaccine propaganda around that is really hurting our community, because they start to listen so many things about the vaccine, and many times that information is being delivered in networks that they trust. It's like networks that they use when the immigration is around their neighborhoods and everything. And then if they find that information in the same network, they trust that information. And sometimes they don't check that if it's a true information or not. And it's because they said, okay, why now the government want to vaccine us if they want to raid out of us? All the anti-immigration laws of our past administration really are hurting the efforts that now the health department are going to get everybody vaccinated. And about access, we really need to take in consideration how people can go and get the vaccine. Because if you have the community separate in so many phases, okay, 65 and plus, but then you have mom, the granddad that is 66, and the grandmom that is 64, and they need to go in separate appointments. It's going to be very hard for them, because maybe it's the son who is going to take the parents to get the vaccine and need to get out of work twice, not once. And when you do your, when you try to reach out to the Latino community or any community, please test your system. It's like, if I call to the health department and try to find information about how to get the vaccine or about how to be tested, is a way that I can get that in Spanish when I am making a phone call. Remember that the Latino community are used more to make phone calls, not to go online. It's easy for us to just get the phone and make that phone call. And many times we don't have a message in Spanish. And if we get the message in Spanish, we need to get through so many labs that we get discouraged and hand out. Just call your phone number and find out if really is working in a way that the Latino community can access, just to be able to register.
I just wanted to piggyback on what Rosario had said, that one of the things that's very frustrating for many in Black and Brown communities is, again, understanding that registration opens and then all of a sudden they're trying, and many do not have the luxury of spending hours on a phone or trying to access making appointments through the internet, hours in front of a computer. What if we're dealing with other inequities that COVID has also really highlighted? The fact that there's challenges when it comes to accessing technology to be able to make those appointments. So what we're doing is not working, and we need to really come together and look at other ways of contacting our communities, because there's a lot, like Cristina said, a lot of misinformation out there. Even if people are looking at the news or accessing information, there's a lot of broadly publicized misinformation that influences how people consider even taking the vaccination. The fact that large numbers of people are getting sick from the vaccination, the fact that it was a rushed process and they developed this vaccine very quickly. People are not quite sure they can trust a vaccine that's been developed so quickly. So we have to do all that we can to go against these fears and help inform individuals with the correct information. And that means it being reiterated over and over again through many different ways, radio, these kind of forums, things that people may not see as being effective anymore, but how do we get those correct messages in front of all of our Black and Brown community members?
During the summer, when we started the COVID testing sites, after a couple of weekends, we were wondering, why don't we see that many members of the African-American community or members of the Latinx community here? So we did a bit of brainstorming, and I think maybe a couple of weekends into it, I was told that, oh, we have a nice big message on the county's Facebook page. And we also have the sections in the news, right? But I had to let them know, for the Latinx community, they don't watch WLOS. There's no designated Spanish speaking news on TV available to them. And also, as far as the county's Facebook page, you have to follow the county's Facebook page in order to be able to read their posts. So we're just hitting not hitting the mark, like really being off the mark. And so it took a while, I think, for a lot of those kinks to be ironed out. But it's almost a year and we're still there,
And sometimes we think that we know everything about our communities, and we need to stop and listen, because maybe we know a lot, but when we go to a specific neighborhood, maybe they have a different kind of fare that we don't even know. I find out that many in the Christian community have questions about the morality of get the vaccine, because they I don't know how been made, and is some rumors circling there. We need to stop and listen and try to answer all that questions before even ask them to put the vaccine. And And it's another first, it's like, it's going to be a chip in the vaccine. I can be tracked with the vaccine. And then I'm going to, if I can be tracked, maybe I can be deported. Many people think too that the government want to get out of all people. You know, there is overpopulation, and now we have robots and everything. We don't need all these people. We are going to get out of many people in the population. And sometimes for you, maybe it's not a valid argument. And even maybe you laugh about, and we cannot laugh about all the comments that are out there. We need stop, listen, and inform. And inform in their own language. And it's not just about give the information in Spanish, but in a way that can be understood. And all the memes, everything that is going around internet, making jokes about the side effects of the vaccine are really hurting our community, because they really fear that maybe they are going to die. Or if they have somebody that died in the community and that person took the vaccine 2 weeks ago, they I don't know why that person died, but immediately they are going to think that was for the vaccine. And we make that connections that maybe not make sense for many people, or the health community, but we need to listen and resolve of that questions and just validate them. How it's like, okay, I am listening to you and I'm going to give all this information, and I don't want to try to convince you to take the vaccine. No, I'm not. I don't want to do that. I give you all the information and you can take your own decision after you feel comfortable with that.
Dr. West. Is she frozen? No, she's moving. It's her time to ask the question. Should I just ask her? Just ask her. What is your response to the medical community that doesn't understand why people of color just won't trust the silence? What would you say to people in the medical community?
Well, I'd like to ask that people, professionals in the medical community, understand that this is beyond the vaccination issue. We're talking about social determinants of health here. We're talking about the lack of access to adequate medical care, increased unemployment, inadequate access to technology, all of these factors that are factors influencing whether or not Black and Brown communities have access. You know, unfortunately, all of these conditions, including pre-existing conditions, have often disproportionately affected Black Americans. And COVID, as well as all of these economic fallouts that have arisen because of COVID, we're seeing that it's affecting Black and Brown communities more than others. So when we talk to medical community, understanding that marginalized communities have oftentimes, again, been victimized within the medical community as far as not receiving the care they've asked to or are needed to receive. With that being the case too, we've got now this vaccine hesitancy where people just are really concerned, and we're going to have to do a better job of getting our medical professionals to reach out and try to nurture trusting relationships. Again, plenty many African Americans I've spoken to are interested in getting the vaccine and would like anyone to get back to a relatively normal way of living, but they can't get appointments. So we need to all work together as a community, specifically with medical providers, about thinking out of the box. You know, how are we working outside of clinics? How are we going out into the community and doing outreach in a way that maybe we haven't done in a long time, but being open to that. And we're just going to have to work together to do this. And I know we can, but we've got to get all on the same page about being creative, and trying to really get rid of, I'd be remiss if I didn't talk about the medical community really addressing implicit bias and thinking about how we reach out to individuals and whether or not we're considered transparent and compassionate and sincere when we do that. We have a lot of work to do, but again, the medical profession is amazing, and I know we can work together to do this. I work with Unitas, and we talk about coordinated care. This is a health equity issue that needs to be addressed, and we're going to be able to fix it only if we work together.
It's so science goes hand in hand, and I'm thinking about this as a member of the Latinx community and what I hear. So science goes hand in hand with the government. Data sources, you know, the companies, you know, the CDC, the World Health Organization, they all work very, close to the government. And the one word that I think will stick out in everyone's head or in everyone's brain is government, 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 right? And we all know the mistrust, the trust issues that are there. So, so I just think the medical community needs to put themselves in people's shoes and understand that it's not, it's very easy to say, oh, the vaccine is there or the medical attention is there. Why don't you just come and get it? Like it was said before, there's a lot of issues or a lot of difficulties with access to the medical care. Just think like they think and try to understand their fears, where they're coming from. And then from there, just sit back and think of how you can, alleviate those fears.
Yes, it's so true, because we really cannot blame our community for the lack of trust, but we need to be thinking in our system on how systematically implement racism when with all that lack of access or when we perceive that lack of access. Maybe it's there, but if we cannot get because the process is so long, it's going to be hard. We need to address all the social determinants of health to have that trust back. And yes. Many times we really can just go to the community leaders, the people in the neighborhoods that they trust, empower them, educate them, and give the resources that they need to have that trust back.
And we also need to ask medical practitioners to think about, again, increasing the numbers of practitioners that look like Black and Brown community members. We have to make sure that we are enlisting the help of community health workers, of people who are out in the community, frontline workers, as well as those knowing that people are more comfortable often seeing a medical professional who look like them. And so if we constantly have or are asking communities of color to go and get care, provider care from individuals who perhaps well-intentioned but do not look like them. We have some work to do where we need to bring in some other practitioners of color, because that's another way of establishing trust in a way that is simple and just basic one-on-one, but we have lacked the ability, or we haven't done as much of it in Western North Carolina in particular that we should. So this is something that we need to continue to do. And particularly during COVID, we need to do a better job of recruiting practitioners of color to help with the entire vaccination, education, and dissemination process.
Dr. West, what would you say to members of the health community?
Well, I'm just listening to this, and this is phenomenal. There's not much I can add to that from Cristina, Rosario, and Dionne. It's just wonderful. You know, I was thinking about the COVID deaths, the number of COVID deaths that we've had, and you would think that it would be very easy for Black and brown people to, you know, just jump on it and get that vaccine because we are dying at horrendous numbers. Though we are distressed with the high COVID deaths of Black and brown people, guess what? We're not surprised. We're not surprised at that. But the message I would say to the medical community is we must demonstrate as a medical community trustworthiness. That's a value, trustworthiness. As I said earlier, that the narrative of mistrust is not fabricated. You've heard the stories. You heard what's going on now. These are people that are boots on the ground that hear these stories. Just know that it's very real. And the vaccine hesitancy that was mentioned is due to lack of trust and fragmented information and where it's coming from. Why should I trust what you say over someone else? And I love what Dionne said about what we call cultural congruence. And that is, we need medical teams, we need organizers to be present front and center, and for the medical institutions to trust these medical providers that are Black and brown and these organizers that are Black and brown, because these folks know how to disseminate information in a culturally congruent manner. They know what works. So please trust, reach out, engage your Black and brown providers and outreach workers. And I had I'll wrap up real quickly. I had a conversation with my son who lives in California, and I talked to my children about the vaccine and what their thoughts are going to be about the vaccine. And my son was just brilliant. I just love what he said. He said, "Mom, it's not about the vaccine. It's about relationships. They don't exist." So medical community, it's about gaining trustworthiness. So, Dr. Lavender, I have a question for you.
Okay.
And that question is, in your opinion, what does the restoration of trust in our communities look like?
I think the restoration of trust for me and for the communities I'm a part of looks like when people of color, when women, when folks from marginalized backgrounds engage in healthcare enthusiastically and optimistically. They believe that when they go to the doctor, they're going to get the care that they deserve. They're going to be treated fairly and equitably, and that the fear of the doctor, we can be afraid of the doctor, isn't rooted in their racial or ethnic background. And they think that, you know, they're not going to be deported if they're Latinx or from other undocumented communities, right? Because We have other undocumented communities in the United States. And they're not going to be mistreated, that they're going to get the treatment for the problem that they came in with and hopefully end up better. I think relatedly, and a part of what you all have mentioned in your conversation is that when they walk into these healthcare facilities with trust, that the medical professionals earn that trust through the care that they get. And that the medical disparities that exist in this country are effectively eradicated. And that no matter what your racial or your ethnic or your nationality, your class background, you get the world-class care you deserve, from routine doctor visits to long-term care and illnesses, birthing, right? There's so much medical disparities in birthing, that your children survive and are able to thrive. And then when you go for an emergency for COVID, that you're gonna get the care that you deserve. I think that's what trust looks like. It's both-sided. Us as a community, we have to be willing to trust, and the medical community healthcare workers have to be deserving of the trust that we give them. And before I open it up to the rest of the panelists, I just want to say that this first part of the conversation is about the historicizing this conversation, talking about the trust, but part 2 of this conversation will really delve into what the COVID-19 vaccine is. But for now, we're just going to talk about trust. So now I open it up to the panelists. What do you think the restoration of trust looks like?
We need to give the community what the community want. They are asking us to, they want to wait and see. Then we need to have some members of the community getting the vaccine, but not just getting the vaccine, but follow up what is happening, how they feel. They are having symptoms, and yes, they have the second vaccine. It's 2 weeks later. How they feel. They are sick, they are okay, and just try to have, because right now we cannot work in all that social determinants of health, because COVID is here, the vaccine is here, and we need to do what needs to be done right now. Just insurance them that the vaccine is free, that they are not going to be getting a bill after the vaccine is been put in their arms. And if they need to know that you, the social community, the health community is there for them. And because the trust, try to have the trust of them in 1 week, 2 weeks, is not possible. It's been years of mistrust in the system. But we can go by neighborhood, have community health workers that they know, and try to do the best that we can.
I think we have to implement something like that, and I think we have to do it quickly. I think I'm in a privileged position because I interpret for the testing sites, I've interpreted for the vaccine sites, and I have received already both of my doses. So it would be wonderful if I could just go grab go to one community and get them all together and be able to just, share my story. I think that would resonate with the Latinx community more than just having just somebody, spewing facts and data and stuff like that. They definitely, I think, would be more receptive to success stories, let's say.
And Cristina, you can share your history, but they want to see when you get the vaccine.
Yes.
And they trust you. And the people that are close to you, they are going to trust what you said. But remember, it's a community that they want to see. Wait and see. And the people that are close to you, they are going to be getting the vaccine. I'm sure of that, because they know that you are doing fine. But that need to be repeated in all the neighborhoods across our counties.
Us
Oh,
being able to get, again, individuals from our communities to be willing to share their stories is so critically important to this trust. Being able to see Black and Brown individuals who are willing to say, and get filmed even. I am taking the vaccine and talking about how they are protecting their families, how they are protecting others in their communities as they take steps to protect themselves. That's going to be critical. I also think along the lines of what both of the panelists, my co-panelists have talked about, is that we also need to be able to see that medical professionals are very concerned about follow-up. I know and understand that, when you get the vaccination, your first dose, that you're being watched carefully for 15 to 30 minutes after then. But what happens a couple of weeks out before you get your second dose? Are we really doing due diligence by reaching out and connecting with people who are getting vaccinated to see how they're doing? Some of this is about, again, Dr. West, as your son said, building trust, building relationships in order to make sure that we're really doing a good job of talking about the narrative that can go along with showing how the vaccination is going to work, and we have to get it. We do not want this to be a time where we have access to something like this vaccination and we have Black and Brown individuals who refuse to take it. That would be the biggest travesty. So we've got to really work together to put the facts out there, to go against all of this misinformation on a regular basis, to have providers continually talk about the trust that is involved and that their practitioners have taken it. Getting the vaccination doesn't mean that you have to stop asking questions. We challenge individuals and ask to hold healthcare systems accountable for these equitable outcomes, because in my view, and as far as health equity is concerned, we are all responsible to make sure that our communities get vaccinated. And until we take it personally like that, we're going to fail. And I don't believe we have an opportunity here to fail without resulting with additional losses of members from our Black and Brown communities.
And you said the other thing that is very important. We want to have doctors, Latino doctors, that let us know in Spanish that have the vaccine is okay, that the vaccine is okay. You touched on that point before, and it's going to be very, very important to see our faces in professionals that just let us know that it's okay to take the vaccine and that the vaccine is safe. I am waiting for mine. Anytime I'm going to put the vaccine, I trust the vaccine, and I want everybody to know that. I trust the vaccine, but when first I was thinking, okay, I really want to take the vaccine or not. And even I have some questions about, but I inform myself and then I decide that is very important to get the vaccine. And I will put the vaccine the sooner that I can.
Rosario, maybe you and I can get the vaccine together.
Wonderful. Yes. Let me know when, and I will go with you.
We'll figure it out. Yes.
Okay, great.
Dr. West, what do you think the restoration of trust looks like?
I think, like I said, I just love hearing what these panelists are saying, because restoration of trust must be genuine. And when I think about that, I think about what I tend to talk about quite a bit with medical professionals, and that's what we call culture humility. And it, it stemmed in a situation very similar to what we're talking about now. But basically, the tenets of culture humility is to do some self-exploration. And we're talking about the medical professionals doing self-exploration of any biases that we may have, because I firmly believe that it's our personal biases that determines the quality of care that the folks that we serve will receive. So if we have some issues, feeling some kind of way about certain people, then it's going to be hard for us to move forward. So we have to do some self-exploration. And then the health professionals, medical community must mitigate the power imbalance. You know, sometimes when people see physicians and those people in the medical arena, they just shut down because it's that intimidation or whatever they're feeling. They're afraid to ask questions, you know, for various reasons. And knowing that, coming in to see that person that may want a vaccine, you know, we need to just mitigate that, just kind of put everything level, make everything level so people can feel comfortable asking us questions. And then we have to be able to share, not using huge words, these $1 words, but just make it simple and easy to understand. It doesn't have to be complicated. The main focus here is making sure that people get their questions answered and that they feel comfortable asking questions. They feel comfortable about it. And then hold the institutions accountable for engaging and wanting to make changes. You know, what do the policies look like far as the communities that we commonly encounter? Is there anyone that represent those communities of color on the decision-making boards and the policy and how we outreach? Who looks like Black and brown people is making these decisions, that's going out into the community? This is important. This is what people look for. And this is what people depend on. So institutions, I need you to engage. I need you to take responsibility and become accountable for this, because this is real. As I said before, the roots of distrust are not fabricated. You've heard all night through this whole session, a whole bunch of examples. You know, there's no reason why we would think that this is all fabricated, because it's not, it's real. So it can happen. Trustworthiness is key.
Thank you all for sharing, and I'm so inspired and ready to ask this next question, which is, what role do you all as community leaders have in educating medical professionals and working with people of color? How are you navigating that space? So for folks who might be watching this, this live, and they might need some skills, some ways to navigate conversations with their communities, what are you using?
With communities or with the medical professionals, right?
Both.
Okay, well, as an interpreter, see, I like this. As an interpreter, I've had a couple of years now of experience as far as, you know, being able to talk directly to the providers, right? We've had conversations with them over and over, and emphasizing like the importance, for example, of having a face interpreter, not just a medical interpreter, but an interpreter with cultural competence. That is so important. It's been, I mean, I can't even tell you the amount of times that I brought up how a culture can change the meaning of a word, or can change the meaning of, or the understanding of a question that the provider asked, you know? And oftentimes they were just mind blown. They had no idea that this actually was occurring, you know? So we have the opportunity to educate the providers on cross-cultural differences, right? These beliefs, they form people and they form the communities, and it affects how they live their life, right? So we remind the professionals also that medicine and science are practiced differently in other countries. They're practiced, they are, let's say, distributed just different ways, and it's okay. It's okay for people to from different countries to have different beliefs or apprehension about certain things. We mentioned that so many times, and it's mind blowing. Just or noticing how I don't want to say clueless. That's a terrible word, but how much there's a lack of knowledge about cultural competence. Cultural competence, I mean, I think that is just absolutely vital, because it's not just being able to speak to, for example, in Spanish to a Latinx community, but communities, you know, like you said, we have people from all sorts of countries and belief systems here in Western North Carolina. So just telling them that is of the utmost importance. It's just critical. And then as Western Carolina Medical Society, as a society, we've made we made an effort to continuously educate the physicians through Vital Signs. Vital Signs is our weekly newsletter, and it's about the services we provide. And then also we collaborate with organizations like a BIPOC to ensure that we're addressing the cultural needs of our BIPOC community. So we can't stop. We just have to continue working.
In my case, I talk more with my community than with medical providers, and I encourage my community to always make questions, make a list of questions that they have for their doctor, and let them know what are the concerns that they have. Because many times when they go to the doctor or when they want to ask if it's okay to take the vaccine, if the doctor really thinks that it's a good idea to take the vaccine, they are thinking that, but many times did not ask because it's not the culture that we have. But I encourage them to make that questions, and we need to keep the channels of communication open. I never try to speak for my community, but just advocate and encourage them, empower my community to make their own questions, to access all the service that they have to have a better life. And because many times when is prevention programs there, they feel so thankful that somebody is thinking about their health, and my community is wonderful because they really appreciate the sport that that the doctors are doing, the health department are doing, and just don't let us down. When we are making questions, when we approach you, when we said that we are not having access, is because it's the way that we perceive that. Maybe it's not true in your point of view, but it's again what Cristina said earlier. Put yourself in our shoes and try to walk with us. Make that phone call just to see if your system is working, if you have your answering machine in Spanish, if you are directing us to the right resources, or if we need to be waiting online for, I don't know for how long. Don't let us down, please.
I also want to say that I think that we need to continue to educate medical professionals that medicine should be all about equity and health equity, and how everyone deserves to have a quality of life that allows them to be able to ask for assistance, the medical assistance they need at any time, without being made to feel a certain way. I think the worst thing that medical professionals can do is ignore the fears and those feelings that people have about being really concerned about any kind of medical situation, but in particular now the COVID vaccination. And the worst thing that they can do is to write these off, or not pay enough attention, or not listen, or not take it seriously, the concerns that patients bring to them. So my challenge would be that we all hold each other accountable, that we all ask that, again, how would you treat a beloved family member? Think about the cultural connections around family and how this vaccine can positively affect the whole health of an entire family, and thus trickle down to affecting entire communities. And once we start thinking that way and coordinating our care and working with one another in a very transparent and trusting way, we'll have better outcomes and hopefully be able to get through this pandemic without losing so many more additional members of the Black and Brown communities that we've seen previously.
Yes.
Well, tonight has been such a rich conversation. I've loved hearing your really tangible ideas and solutions and for the medical community and a lot of compassion and care for the communities of color that we serve. In this last minute or so, I'd like us to go around and maybe do a closing remark, a word, or just the last short little message to our communities before we say our goodbyes.
I was thinking equity, it's a trendy word, right? But equity can't just be a trending word that we're all using nowadays. There's a lot of things that need to be fixed, but right now we're in a global pandemic, and health equity is a basic human right. And like was said earlier, we're all responsible for helping each other get through it. And like Dionne said earlier, it's like failing is not an option right now. We can't afford to get things wrong right now.
I also believe that, again, health equity is what we all should be focusing upon to be able to work through some of these dilemmas. I believe that, again, as we are the richest area in North Carolina, we are one of the richest, most wealthy countries in the world. We should not be having these issues around people, Black and brown people and marginalized communities having to struggle to get the access to healthcare they need. We have to continue working on this. And again, COVID has put this more in front of all of our faces than previously. So we have to continue working together. Thank you so much, Cristina and Rosario, for allowing us to talk about this together.
Thank you, Dionne.
Thank you. I just want to ask my community that if they have concerns about the vaccine, that they need to go to the doctor or to a good resource and get more information about and resolve the questions that they have. Because we don't have too much time to be thinking about this. We need to really go and get the vaccine. But is what I said, I don't try to convince anybody, but I encourage to get information, ask your doctor, and get informed and participate. If you can be making questions right now, I just see one question for the panel, but we can have hundreds of questions. Why you are not asking questions? This is the time to be asking our professionals why we need to be taking the vaccine, or all the mistrust that you have. Right now is the time. You can be asking and get the answers that you need. I don't know who else is.
Dr. West, do you have any closing remarks for us?
Oh, I just like, again, I can't say anything more than what this wonderful panel has said, but I think about this quote that Dr. Martin Luther King Jr. said, that we are caught in an inescapable network of mutuality. This whole topic, what we're talking about, as my son mentioned, relationships, it's loving each other, caring enough about each other. But he said we're in this inescapable network of mutuality, tied in a single garment of destiny. Basically, whatever affects one directly affects all. We must learn to care about each other.
I can think of no better way to end our conversation. Thank you to each of you for participating in this panel. I'm grateful for the county for bringing this partnership together, and for all of you who have taken the time out of your days to listen to this live. Again, the information will be available on buncombecounty.org and YWCA-Asheville.org.
Thank you.
Thank you.
Thank you so much.
Thank you.
Thank you so much to all of our panelists this evening, and thanks to all that were able to join this conversation. It's meant so much, and I do, a call to echo this comment of the ties that bind. And I would just point everyone who's been able to join this discussion as a reminder to our county's motto is that people to watch our mountains. And in the same way that we are watching our mountains, let's be there for one another. And we know that this pandemic has created so many challenges and so many big questions. Some of those questions we obviously were able to discuss today in terms of the history, that path to repair, what trust means, and how we can actually build some meaningful and genuine bonds to be in a place of understanding together. We know that today we started in talking about that historical, the social, and the cultural roots of all the big questions around the vaccine. And we hope that you'll join us in the next 2 weeks where we'll continue this conversation in part 2 and when we'll discover all of the nuts and bolts of the questions around the vaccine. There, we'll talk a little bit more about how it was made, what is the experience like at Buncombe County vaccine sites, what to expect, who's there, and how we can help. For now, we know it's a long process, but we've made it this far and we've made it Buncombe strong. And so we're asking for you all to continue to be there and to continue to be among the chorus of warm and loving community neighbors that are here to watch our mountains. One more bit of exciting news. We've all been working with some of our local partners, including the Western North Carolina Community Health Network, also local community health department communicators, and also MAHEC to create a toolkit to help you hold a conversation. It could be in your kitchen, it could be out with those that you worship with, those that you learn with, or maybe your block association. So you all can also have a close and trusting and data and fact-based conversation on the vaccine. So stay tuned for that as we'll be sharing it on our social media networks. And until next time, we're going to ask for you all to please continue watching buncombecounty.gov.org if you want to know more about our upcoming testing events. And for the most reliable information on the vaccine, we encourage you to visit the NC Department of Health and Human Services site. And so until then, be well and stay safe. And thank you all for your curiosity and for participating in this community conversation.